I'm a team lead with Teen emPower, and I work with the SHAPE members. SHAPE stands for Sexual Health and Peer Education. So basically we teach high schoolers to go into middle school classrooms and talk about social pressures, peer pressures, and overall understanding the consequences of sex and how it really impacts the youth in our society.
It's better for someone who's closer in age to the 7th graders or the middle schoolers at all to connect with them. Because I know like when I was in middle school, sometimes like an authority figure would seem kind of like intimidating and you don't want to always listen to them. But if you're closer in age with someone, you kind of form more of a connection with them. They're more relatable, so you're more likely to listen to them. Some of our teen educators talk often about how they, help their friends out with some scenarios from the things that they've learned from the curriculum. They apply it to real life situations and they talk to their peers about it. So not only are they teaching others, but they're learning stuff themselves and they're going out and sharing that with the world. So I think that's an amazing thing that we do in this program is that, whatever they learn here, they're willing to share.
I plan to use the knowledge that I'm learning as a peer educator to create a safe space for my peers who may not have access to this information and give them that knowledge. Or as an adult, I could also be a safe space for, teenagers or children that I may work with.
I wish that people knew that sexual health is not political or religious. It's something that everyone needs to know about. And the things that we teach are more about unlearning some things that toxic elements of our individual culture. I think that SHAPE tells people, no, you have a right to say no, or to just set a boundary and have people respect that. That's your right.
The things that they learn, they actually apply. Like you can see when we're in the classrooms, like the thoughts and things that they're learning, like generating in their heads, and they're starting to apply it to real life situations because they'll give us examples of how they could apply that to something that happened in their life. So just having a direct impact with them and interacting with them directly and knowing that they're applying that in their real life situations is a big impact that we do.
Every young person's life that we are able to impact in some way, whether we're educating them as 7th graders or whether we're working with them as high schoolers, just knowing that they are receiving something that is so valuable and really rare, right? There's not a lot of programs like this in the country.
Again, we go in with talking about the consequences with sex, and we talk about the relationship aspect of it, as well as just kind of finding themselves and what they believe in and to make decisions for themselves, which will help them be prepared for the outside world.
I wish people in the USA knew that it's just not something easy to learn. It's something that you really do have to invest in and learn about, or you won't know. It's not something that you're born with and know. You have to learn it.
If I could describe Teen emPower and SHAPE in one word, I would have to say empowering. Because we empower the students to make their own decisions and to take control of their lives, especially when it comes to accessing information about their health and specifically about their sexual health. But we're also just empowering community members to learn this stuff. We're empowering our partners to put more education out there. We're empowering high schoolers, even college students. We take in interns. Really anybody that anyone in our program meets, it will not take long for them to hear about Teen emPower because we love what we do so much. And we just want to empower the community around us to not only understand what the issues are when it comes to teen pregnancy and teen pregnancy prevention, but what the solutions are and how we're affecting them.